Hi, my name is Meghan Healy, and for my project, I researched different factors that affect a child with disabilities' chances of receiving treatment in South Africa. So just as a little background info, every year the Stats South Africa Annual General Household Survey asks respondents about different areas of their life that they may have difficulties in, such as seeing, communication, and walking. And in 2009, they found that 2.1 million children, which is roughly 11% of the child population in South Africa, has some kind of disability. And then another study conducted by Arnold Christensen found that in rural South Africa, intellectual disabilities have a prevalence of 36 in every 1,000 children. So the United Nations has several documents that pertain to protecting the rights of children with disabilities. The Convention on the Rights of Persons with Disabilities and the Conventions on the Rights of the Child both state that children with disabilities have the right to enjoy the same freedoms as anyone else and also have the right to accessible treatment. One factor that affects the availability of treatment in South Africa is legislation, and the South African Schools Act declared that public schools can't turn a student away due to a disability, so this really gives children with disabilities the chance to go out and receive an education because they know they can't be turned away. Another barrier that education deals with is communication barriers in schools. Oftentimes there's a lack of trained professionals that know how to deal with special education students. So for example, deaf students oftentimes don't have teachers that know sign language, so they're missing out on educational opportunities because they can't communicate with their teachers. And then also a lack of financial resources prevent these schools from being able to buy assistive devices to help facilitate the communication as well. But also in South Africa, they are creating private schools that are able to, offer treatment and education to these students. And one example is the Hope School outside of Johannesburg. And it offers both the mainstream education and treatments such as OT and physiotherapy. Socioeconomics also play a big role in a child's availability to treatment because oftentimes if children are living in rural or poor areas, they don't have access to transportation to get to and from their treatment. So they're simply they're not able to receive treatment because they can't get there. And then oftentimes a lot of children who are living in poverty with disabilities, they don't have the means to afford being able to go to places like the Hope School or even just treatment in general because, like that's been mentioned tonight, there is the public sector of healthcare, but it doesn't cover much, so they don't have the means to be able to get this kind of treatment. And across the world, children, no matter where we are, they face similar difficulties of being able to receive an education and receiving treatment. And just one stat from the World Health Organization says that between 35 and 55% of people in developed nations and 76 and 85% of people in developing nations who suffer from mental disorders did not receive treatment this past year. And then one theme that I found that relates to this topic from QU301 and 201 is inclusiveness. And I thought of it also from Bantu education from apartheid, how students were separated based on their race. And now in today's society, a lot of times students are based off of their ability to achieve and the ability to have scholastic achievement. So students with disabilities are oftentimes kind of kept in their own classroom, so they're missing out on being able to relate with their peers just because they have these disabilities. And then as a member of the global community, I just feel like this whole semester my eyes have been opened up to different injustices, not just children in South Africa who are having their rights impeded on because they have disabilities, but also girls in Thailand who are being sold into sex slavery and people in Bangladesh in these garment factories. And I just feel like now that I have learned about this, I feel like I have the responsibility to make others aware of it as well, because I feel like we're not able to right these wrongs until people are aware of it, because if you don't know what's going on, you don't know to try and help it. And thank you.
Just go a little bit in terms of how it relates to your major.
I'm an occupational therapy major, and my ultimate goal one day is to open up a camp for children with disabilities. And I really find it so interesting how, there's so many ways to be able to treat a child. Even, take a child can't walk. You can put him in a wheelchair, but you can also give him crutches. You can give him what Alex is using. There's so many different ways to treat one issue. And I think if people had access to these kinds of treatment, they'd be able to do so much more in their life. Thank you.